when you have high blood pressure or hypertension, which is the same exact thing, there's always an underlying cause that's making the high blood pressure, which is creating making your heart work too much for the high blood pressure. So if you can fix the underlying cause, the hypertension goes away. So we want to try to bring up a couple different options you can do, because we all know if you go to the doctor and they put you on blood pressure lowering medication, after a few months it's going to cause an issue in some other part of your body, and all of a sudden, you're on 3, 4, 5, 6 different types of medication, all because you're not fixing the underlying cause of high blood pressure.
Dude, I gotta tell you, I'm really excited. When we were looking to figure out what we were gonna talk about, and we mentioned hypertension, I got really giddy and also nervous.
Yeah, you have a little
Because
bit of personal background with that one, huh?
yeah, man, like
Yeah.
it's and I mean like personal
Mm-hmm.
family background with it, like, and I gotta tell you, bro, it's like constantly there. It's like I'm
Yeah.
always like, I'm checking in with my doctor. I'm like, hey, here's my BP. And I'm like checking it every couple days and like taking my meds. So uh this one holds something special for me, man. Especially like, bro, I think I don't know if I told you, but one of my brothers, my mom had hypertension for a lot of years. Oh, by the way,
Mm.
hold on, before we look at us, man, we getting all into people. Welcome to dude.
Oh yeah, we forgot about you guys.
We
Oh
forgot
yeah,
about you, man. Look, we get some.
yeah,
Listen, this is
yeah,
what happens when we start recording now.
yeah.
So listen, everyone, welcome to It's More Than Black or White podcast. We are your hosts, Paul and Brian. 50 years in the health and wellness industry, and we're here providing the goody goods and the other nuances to the common things you hear about here out there as far as health and well-being. We range a lot of different topics, and we talk to you about ways that you can take care of yourself differently than what you may hear from your doctor or what you may see out there. We're giving you some real data and some really valuable information to help you be the captain of your ship and take control of your health and well-being. And today we're talking about hypertension. Okay. B, how's your blood pressure, by the way? How's your blood pressure?
Actually, if anything, my blood pressure runs a little on the low side.
Yeah, because you chill as a mug, bro.
I know. I just go in there.
You,
I'm just like, whatever, man, bring it.
you
You know.
chilling. Um, so so listen, I want to. Oh, this is important, right? Because heart disease is one of the leading causes of death in our country. Okay, this is a serious condition, and the thing that I like I was saying in the intro when we first got started, there's a little bit of fear here for me. No, I wouldn't say fear, but there's like this is personal for me, man. Like, and a lot all the topics that we've spoken about or that we've discussed here, they mean something. And this one, bro, like, because dude, listen, my mom had hypertension for through 40 years, to the point where she was taking a whole bunch of meds. I think like one time she was up to like 7 meds.
Yeah.
So by the time, like, she got sick and she got, her organs are basically failing, they were like, look, I'm done. And like she passed on. One of my
Yeah.
older brothers, Chris, was on high blood pressure med. He had congestive heart failure. The dude's got a new heart now. He was on a whole bunch of heart devices. Also got a new kidney because processing all the meds and what have you. And then my other older brother's has heart disease. He's on kidney dialysis right now.
Mm.
So, and I got high blood pressure. Fortunately, like I'm averaging, like right now I'm averaging like mid 120s.
All
I'm
right,
a
that's not
high
bad, man.
90s recently, huh?
It's not bad at all, man.
Not bad, man. My lower
No.
number, I'm high 90s, so I want to get that down. My doctor was like, "Yo, you need to watch that shit."
Yeah.
Um, but yeah, dude, like, so this is, this hits home for me, man, because like I've had, family members with, like I mentioned, with heart disease. I've had friends of
Mm.
mine die of heart attacks. Former clients have heart attacks, so
Yeah.
this. And for you watching, you may know someone or you may have hypertension. So this episode, please get out your notepad, get out a pen, be ready to pause and rewind some of this detail because we're going to go into some things that you can do outside of the meds
Yeah.
that will support you in getting everything in order. So,
Yeah.
B, before we dive in, man, like any other piece that anything that I forgot to mention before
Yeah.
we
I
hop
mean,
in?
no, I mean, you pretty much hit the nail on the head. I think cardiovascular disease is still the number one cause of death in
It is,
America.
yeah.
I believe it's also, from what I'm reading statistically, since COVID, since the vaccinations, and I'm not judging anybody or if you got a vaccination or not. We talk about that a little bit in episode 14, the nitric oxide episode,
Yep.
on what the vaccination it contains, the spike protein, which blocks your nitric oxide. We'll get into a little bit of that, but if you want to watch the whole episode later in episode 14, we really get into details. You're like, oh, what does nitric oxide do? Again, we'll talk about that. We'll talk about that in a second. But what I like about this episode, there's so many natural things you can do to reverse the high hypertension or to reverse high blood pressure. So one thing that's very important to understand is when you have high blood pressure or hypertension, which is the same exact thing, there's always an underlying cause that's making the high blood pressure, which is creating making your heart work too much for the high blood pressure. So if you can fix the underlying cause, the hypertension goes away. So we want to try to bring up a couple of different options you can do, because we all know if you go to the doctor and they put you on blood pressure lowering medication, after a few months it's going to cause an issue in some other part of your body, and all of a sudden, you're on 3, 4, 5, 6 different types of medication, all because you're not fixing the underlying cause of high blood pressure.
Dude,
So yeah, I mean,
people,
you just talked about it.
Brian, man, dude, I see it on a regular basis, man. Like, oh wait, I don't have my thing here. Oh wait, hold on. I see it on a regular base. I don't know why this thing is not okay. Hold on. All right, I'm just gonna go back to this here. All right. So my thing is I see it on a regular basis, man. Like I see it with, like I said, with former clients. But you hit something on the nail, you hit the nail on the head so well, because when I'm going to put myself in this as the we. When we fail to take care of the underlying issues, other parts of our body, other organs are going to be taxed. That's the beautiful symphony of the body, people. Like, if one thing is struggling, other things are going to pick up the slack.
Yes.
So, and when you look at, and we're gonna go into this, but I want to be I was looking up some of the statistics because I was like, you know what, I'm curious. So you're correct. Cardiovascular disease remains the leading cause of death in the United States, accounting for almost 1 million deaths since the year of 2020, bro. Only 3 years, close to 1 million deaths. Um, Coronary heart disease was a leading cause of deaths attributed to cardiovascular disease in the US, followed by stroke, high blood pressure, heart failure, diseases of the arteries, bro.
Mm-hmm. Yeah.
So, bro, man, something's coming up in me, man. I'm just like, shit. Anyway, high blood pressure. What the heck is this? All right. So, B, you want to go into it? You want to touch on
Yeah, I
that?
mean,
Kind of.
the simple definition, or the abstract definition, high blood pressure is basically a constriction of the blood vessels, so the heart has to work harder to pump blood.
Yeah.
So when the heart has to work harder to pump blood around the body, it causes more, basically it just causes more stress to the heart, causes more stress to the blood vessels. And again, it's important to know that hypertension in the body is signaling you that something else is wrong or going wrong, or something else is not working correctly within the body.
Yeah.
So that's all it is. It's a constriction of the blood vessel.
So yeah, and it's very interesting because when you think about, so people, when you think about the constriction of the blood vessel, I want you to also think about a pressure buildup. Okay,
Mm.
so when you have your blood pressure, you're usually going to get two numbers. So you'll get your systolic number, which is the first number. Then you get your diastolic, and the systolic is the pressure in your arteries when your heart beats. Okay. Then you have these chambers, they open up, they move blood through, and then you get your diastolic, which is the pressure in your arteries when your heart rests between beats. So if your heart is working super hard, this pressure is like, and it's like, it's constantly, like Brian was saying, it's making your body, you're making your heart work harder. One of the things that's really that's, when I first got onto my blood pressure medication, because bro, I didn't, there was like years I didn't take my shit, bro. It was like, I'm not taking that junk. And my doctor was like, it's crazy. My first doctor that I started really going to, Dr. Murdoch, right? He was the dude that was like, look, Paul, man, your family history, I want you to be here for a long time. You're going to die. Okay. Like, you see it with your family, you see it with your brothers, everybody's got it. I want you to live. And at that time, I just had Elijah. So I was like, oh man, all right, man, you got to give me the guilt trip, doc. But I'm glad he did, because literally like 2 years, yeah, it was about 2 years after he got me on my blood pressure meds. The dude died of a heart attack.
Jeez.
He
Man.
died of a heart attack, bro.
That's not an eye-opening, right?
Bruh.
Well, you know, it's funny that you said that. Not funny, haha, as you would say, but funny,
Yeah.
like, I'm getting
Right.
all my Paulisms in here.
Yeah,
But
Paul.
like doctors and cops are like one of the leading people that have a lot of heart attacks. And it has a lot to do with because they're shift workers. So we talked about before, little side tangent, like, you're between the hours of, you got your circadian rhythm. So between the hours of 10 p.m. to 2 a.m., your body goes through a physical repair. But a lot of cops, they do like 2 weeks on day shifts, 2 weeks night shifts, 2 weeks day shifts, 2 weeks night shifts. So they're constantly, their body can never recover. Same thing with doctors. They're doing a lot of night shifts. And it's basically like, if you keep flopping back and forth, it's like almost like it's like living in like New York City for 2 weeks, then living in Tokyo for 2 weeks, living in New York City, and that destroys your body because your body can never repair itself.
Dude,
It's
that's
bad.
an issue, man. That's a freaking
Yeah.
issue. And this is, dude, it's so wild, man, because my mind is like going in so many different places that even that chaos of a job can create a stressor,
Oh yeah.
a tightness, a tension. Like, I mean, I'm, I can get all woo woo, but like, there's an energetic tension that can come about it with stress related, like stress. Like, dude,
Oh yeah.
like, perfect example. When I go into the doctor and they put me on that, even my heart, my blood pressure monitor at home, it squeezes my junk so tight. I'm like, God damn, I gotta take it like 3 times, bro,
Yeah.
because like the first time it's like that stress. I'm like,
Mm-hmm.
and my
Yeah.
blood pressure, dude. Then I was like, okay, I gotta calm down. But like what you're saying, like that stress and tension, like on off, on off. Plus, like
Yeah.
with the sleep pattern, man, dude, sleep is important too. But what
Huge.
happens is like when people have these different conditions, it's easy. And look, we put a lot of stuff on doctors, right?
Mm-hmm.
People with blood pressure, high blood pressure, heart disease. I'm putting some of this on you because, listen, we're gonna go over some stuff here. Please, like, I'm taking this to heart myself because I'm like, yo, I'm getting on my magnesium game, making sure I get on for my walks in the morning when the sun rises, man. Let the sun glisten on my beautiful caramel skin, and freaking make sure that we take care of this, because what's going to happen is if you go in, you have high blood pressure, you have heart disease, the first thing they're going to do is put you on medication.
Mm-hmm.
Your body's going to react, is going to create some sort of adverse effect, and then you go back to your doctor and they're going to put you on another freaking medication.
Yeah.
Okay.
Yeah. And you're just masking it. Even if that medication lowers your blood pressure level, we still talked about it before. There's a reason you have high blood pressure and you're not getting to the root cause of the problem. You're just putting a band-aid over on it. It's
That's
like if
it.
your check engine light goes on your car, is it fixed if you just take out the bulb? No, your car's going to eventually break down. But people don't put two and two together like that. You
Man, that was a great example.
know?
That was a Brianism. I'm using that piece. So B, let's get like we're whetting their appetite with some of the goody goods. So
All
like
right.
Brian is this guy, man. I'm like, you're like, I don't know, it's like you're a mastermind because Brian, you have the, and you people watching, you already get the vibe. Brian has the ability to take something that's complex because he knows it, understands it. He could take something complex and make it relatable and simple. So Brian wrote down some notes. We have notes before these calls. Well, actually, Brian's got notes. I'm working better at it. Brian's got notes. B, can you take us through some of these things? And I'm going to go through as like a person with high blood pressure, heart disease, and I'm going to ask some questions here, man, so the people that are watching can get as much as we can from this, man.
Yeah. So if you guys haven't checked out episode 14, we talk about nitric oxide. Doesn't sound sexy at all, but it plays a huge role, especially if you got the vaccine or you've had COVID. Please watch that episode. It'll change the way you think about your body. And you might be realizing you might be having all these symptoms since then, and you can be like, oh, this is what's causing it. Let me do something more in a natural way. So take a look at episode 14. Again, I'm not judging you get the vaccine or you don't get the vaccine, whatever it is, whatever the issue is. Know the vaccine has that spike protein in there, which blocks nitric oxide in your body. Your body needs nitric oxide to have your blood vessels contract, restrict. So that is super important. And a lot of people, they have these nitric oxides. So basically, I'm going to get a little bit into the science. You basically have two nitric oxide pathways in your body. You have something called the nitrate to nitric oxide pathway, and you have something called the arginine nitric oxide synthase pathway, or your what they call your NOS pathway. Now, your NOS pathway, at the time you're 40 years old, you only get about 50% of the nitric oxide in there. And by the time you're 60 years old, that pathway, you only get about 15%. Okay. But what's beautiful is that first pathway we talked about, nitric oxide pathway, if you fix this pathway, it can help the NOS pathway get a little better. So one thing you need to understand about nitric oxide, again, we'll kind of go back into it. It dilates and constricts the blood vessels. It stimulates hormones. It regulates neurotransmitters in your body, like dopamine, serotonin. Those are like your feel-good hormones. Something called acetylcholine, which is good for your memory, your learning, your attention. It increases blood flow and oxygen to every part of your body. One of the main reasons that men have to go on Viagra or they have issues in the bedroom is because they have low nitric oxide in your body. Right. So low nitric oxide can leads to causes and like blood sugar levels to be all over the place. So like, especially as when it comes to fitness, one of the first two things I always try to address when somebody comes to me and wants to lose weight, I'm like, all right, we got to cut down inflammation and we got to balance out your blood sugar levels. Those are the two most important things right away. Because if you have too much inflammation, you can't build muscle, can't burn body fat. If your blood sugar levels are all over the place, it's almost impossible to drop body fat and build muscle at the same time. But again, if you have no nitric oxide in your body or very little, your blood sugar levels are just like all over the place. And when that happens, you can't think clearly. You have sexual dysfunction, like we talked about. You become insulin resistant. Your vision goes. Your kidneys, lungs, and brains are not working correctly. So we really want to make sure we have enough nitric oxide in our body. So there's a couple of things I want you to kind of avoid. Like one is non-organic vegetables. The reason I want you to avoid non-organic vegetables is you have something called glyphosate that's sprayed on it. Again, go back to our videos. It was so important that we actually did a 2-part video series of glyphosate. If you've never heard of glyphosate, man, you got to educate yourself on this, because not a lot of people do understand about it or know it exists, and we're putting this in our system. And I think, to me personally, I think is the number one reason people have their cardiovascular disease rate is so high of deaths. I think is a number one reason. And we talked about, like babies being born with Down syndrome. It's been going, I mean, it used to be like one out of like every like 200, like 15 years ago. Now it's like this, I think we said back in the episode, like the year 2034 hits, it's going to be one out of every 3 babies will be born with some kind of neurological issue, such as Down syndrome or autism. I'm sorry, not Down syndrome, autism. So do your research on glyphosate. Look at our 2 videos that we have in there. Also, when you use mouthwash, it kills that nitric oxide in your body too. So mouthwash is like, oh, people are like, the reason I bring this up is 60% of people use mouthwash in America. So what's happening is, like, it's bad for your gut if you take an antibiotic. It's like basically just napalm blowing everything out. Yeah, you kill the bad bacteria, but you also destroy all the good bacteria.
Right.
Same thing with mouthwash. It's an antibacterial, so it just blows everything up and it kills bad bacteria and good bacteria. So you have a lot of nitric oxide actually gets made in the back part of your tongue. And when you put that mouthwash on there, it's just basically just leveling everything out. Consume more high nitric veggies, arugula, spinach, beet, celery, bok choy, butter lettuce. Those are all good, but again, go to organic. No, because it doesn't have any glyphosate on it, or not as much glyphosate on it. And the main supplement that helps with nitric oxide is something called potassium nitrate that helps build the nitric oxide up in your body. So those are little tips on nitric oxide. Paul,
So,
what do you got for me, bud?
so I want to make sure I'm hearing is basically like, so with nitric oxide is going to ease the blood flow and the constriction. So it's going to, if so in this particular case, it's going to help the heart work more efficiently rather than work as hard as it has to work.
Gonna take a lot of stress off the heart.
Okay, that's huge. That's huge. And now
Yeah.
also what I was hearing you say is that it's the nitric oxide is really helping things move throughout the body. So first of all, it's helping the oxygen get to different parts of the body. So again,
Yes.
it's making the heart more efficient. I was
Mm-hmm.
also help me understand because like I was following you with the blood sugar.
Mm-hmm.
How so from my understanding, right? So the a correct amount of nitric oxide in the body will help level blood sugar levels, right?
Yes,
Is that correct?
it'll help balance it. It's not the only thing. I think one of the main things is your nutrition.
Yeah.
But if your nutrition's on point, but you don't have enough nitric oxide in there, your blood sugar levels will be all over the place still.
Wow. 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 Because
And I
it's like
wouldn't
when
say
you
it as drastic as, like, if you're eating like a bag of Skittles and your blood sugar levels spike to, like, whatever it is. It's not going to be like that drastic, but it's going to be
yeah.
very hard to balance everything out.
Aha. Okay. Okay. And it's interesting because like as you were talking about like with the nitric oxide with the NO levels, well, with this in the body, increase the blood flow. I thought it was really fascinating because when you were talking about vision goes, brain's not working properly, I'm thinking about like the diabetes and all these other diseases that are associated with heart disease.
Mm-hmm.
So it's like, and it's coming back to when you were talking about the root, like getting to the root. Like if the heart disease is happening for a person, then it's going to impact other things. And I this was the first I really understood about even the brain failing to work as well.
Yeah,
Because like
you don't get oxygen in there.
yeah,
Yeah,
it's wild, man. Because I can remember my mom, like she would be like, toward the later years, she was just like, I just can't remember things.
yeah,
It's just like, and I'm like, dang, man, like,
yeah. It's
wow.
hard to
Even my
remember
brother
things when you
man
don't get
can just,
oxygen to your brain.
yeah, yeah. You
Yeah,
need oxygen in the brain, man. Oxygen is
yeah.
important. So it's interesting because, and I'm happy that you mentioned about the glyphosate because when you talk about that protein that's blocking the nitric oxide, I think it's very interesting to know that, well, wow, shoot, like, well, what struck me was that when you were talking about I think it was the pathways, right?
Mm-hmm.
The arginine nitric oxide synthase, where well, as we get older, it's like the pathway is smaller, right? So it's not
Yes.
bleeding out as much. So I was thinking about like when there was like when people started getting the vaccines, there were a good amount of like heart attacks and heart failure.
Yeah.
And is I mean in this situation, because I heard you mention before, like for people that have had the vaccine, as
Mm-hmm.
more like a safety mechanism, having this like making sure that the nitric oxide levels are good. um like damn, man, It just
Yeah,
had
and
it just
I
had
learned that. I learned that from a doctor, a buddy of mine
Mhm.
who's a doctor, and he told me when it started coming out, they started doing a lot of testing with the vaccines, and he was like, just be careful. It's like because it's going to have that spike protein in it, and
Right.
like the first thing that's going to happen, even before I heard about all this heart stuff, he's like, people are going to start having a lot of inflammation of the heart. You're going to see cardiovascular disease. You're going to see heart attacks really jump. And I was like, I mean, I'm pretty open. I'm like, I don't, you know, personally, I don't trust our government too much for it to help us heal.
Yeah, yeah,
We have to take responsibility for our health, and that's one of the reasons I'm doing this podcast with you,
yeah, man.
is to kind of open people's eyes a little bit and help. Hopefully, they do take responsibility for their health, and they just don't listen to the FDA. In my opinion, they're trash. But he said, he's like, he's like, and that's what he got me on the nitric oxide. He's like, because it's like it depletes your nitric oxide. And at the time I was like, this is going back 2 3 years ago, and I was like, I didn't know too much about it. Like, remember I was talking about, like, oh, we used to take nitric oxide to get a pump before you go into the gym.
Yeah,
It was like a
yes.
powder form. And I started reading up more about it, and I started listening to more doctors on it and everything like that. And I was like, holy shit, like 99.99% of people don't, they're taking this injection, or they're taking this vaccine, and they don't even know they don't know what they're doing, man. I mean,
Right.
like, not that they don't know what they're doing, but they don't know the side effects that's causing this. And the doctors, I wouldn't say they're holding back information, but they don't know either.
Right.
You know?
Right, man.
So I mean, this guy was he was a virologist, so he
Yeah.
wasn't just like an average doctor. You
Yeah.
know, he actually knew how these symptoms work and how the viruses worked in the body. And this is how we had this conversation. Nitric oxide popped up, and I just went down the rabbit hole, and I was like, "Fuck, man!" I was like, Paul, so we need to do an episode about this.
Yeah, man.
Like, at least like if a couple people just listen to it, and you do it like I said, we do what you want with the information we give you,
Right.
but it comes from a good place. It comes from love, and hopefully it changes your perspective a little bit.
It's all love, man. It's all
Yeah.
love. And it's all and it's also personal responsibility.
Mm-hmm.
Okay. Like you could do whatever you want, with doctors or getting your vaccine or not getting your vaccine. We're detached from all of it.
Yeah,
Our main thing
exactly.
is that you have the tools to do what you get to do to take care of yourself and be here for the long haul. B, I know we got a couple other things, so I want to dive into those to
Yeah,
the
man.
other things. The other one you mentioned is vitamin D. Getting
Yeah.
out for the sunlight. Because the first thing I think of vitamin D, I'm like, yo, get that sun, baby, get that
Yeah.
sun. But there's other
Yeah.
things to that too, bro.
Yeah. I mean, vitamin D, it's a fat soluble vitamin. So 80%, so meaning, like, if you're going to take vitamin D supplements, make sure you take it with some kind of fat so you can break it down.
Mm,
That's A, C, D, and E, or no, I'm sorry, A, D, E, K. Those are your fat soluble vitamins. 80% we get from the sun. The other 20% comes from food and supplements. So
okay.
vitamin D is important in bone health, muscle strength, prevention of cancer, cardiovascular disease. I mean, this is what we're talking about: type 2 diabetes, immune function, premature death. Actually, one of the things you want to pay attention to, it's what vitamin D. It's one of the first things needed to create a whole series of like enzymatic reactions to actually lower blood pressure. So I don't know all the steps and all the science behind it, or like it does this and this and this, but it's like the foundation of everything, with all these chemical pathways and all these chemical, basically reactions to help lower blood pressure. So if you're low in vitamin D, you will have high blood pressure at one point, or you have
Mm,
it already. So one of the things, one of the main reasons is because you don't have if you have inadequate vitamin D, this decreases the hormone aldosterone. I don't know if you've ever, like, most people out there might not have heard of it, but it's in the kidney and it controls blood pressure. So aldosterone increases the sodium reabsorption within the kidneys. So too much aldosterone causes the body to retain both salt and water, which increases blood pressure. So vitamin D decrease the aldosterone. So the lower your vitamin D is, it's almost like an inverse relationship. The higher aldosterone will be, and the more your body's retaining water and salt. That's why when you go to the doctor, and you have high blood pressure, chances are your aldosterone levels are high. And the doctor's like, oh, I don't want you taking any salt. But the doctor has so little knowledge of nutrition. And there's a big difference between salt, table salt, which has been bleached and burnt at like 400 degrees,
Yeah.
and Celtic sea salt, pink Himalayan salt, Hawaiian salt, which actually is so beneficial for your body. But that's one of the reasons they don't want you to take salt, because your aldosterone levels are high and your body's retaining too much sodium as it is. So when you go to the doctor, and you have your blood pressure, when you have your vitamin D levels done, which is basically standards on every single test that I can remember, you always want, you're at risk anytime your vitamin D levels, which is called your NMOL per liter, so nanomoles per liter, are below 25. So when I was working with Charles Poliquin back in the day, I wasn't working with him, but I was taking a lot of his courses. He said the average American levels are about 18. That's an average American, 18. So we know anything at 25, anything at 25 and below, you're at really high risk of cardiovascular disease. And he said most Americans, your average American, is around 18. So he said you want to get to a normal. He said he hated the word normal. He's like, stop getting to a normal level. All these levels are done for people that go into the hospital. The way they get a lot of these statistics are, like, just say a normal level is 50. People that go into a hospital, they're already sick, and that's how they're getting their statistics. So you want to be optimal. You know what I mean? Healthy people don't go to the doctors too often. Right. No. If you're sick, you go to the doctor. And like me, I'm like, I haven't been to the doctor in 15 years. Like, I just don't. Like if I break my arm or I hurt myself really bad, yeah, I'll go to the doctor. But I'm not going to go to a doctor to tell me general health, because I have a feeling, and I'm not being like, not being like an asshole, but like I just know more than that person when it comes to preventing diseases than they do. So, I'm not going to sit there and listen to, my doctor with a belly tell me how to, be, so,
that's so
you want your optimal levels to be over 81. That's where you kind of want to be, around 80, 81, he always said. So try to get those levels up high. So if you're like, a doctor's like, oh, you're normal, and you see the levels are at 30, dude, you're not normal. You're normal because everyone in the United States is like, a normal guy in the United States looks like Homer Simpson. That's crazy. Not normal. You want to be optimal.
Right.
So push those vitamin D levels up. That's so important. It's so important on so many levels, especially like guys, like, it's actually a natural growth hormone in the body. So if your goal is to build muscle and lean up and burn fat, like, you want to take vitamin D. And it's like the cheapest supplement out there, man. Just take vitamin D. Take D3, not that shit D2 that's out there, which is a synthetic form.
So what's the regimen like on taking D3, right? Like, is it like, what would you recommend for someone that's like, I think I'm going to take my first step? What is that?
Yeah, so I hate to give numbers. I'll tell you what I did and how I saw the best results.
Okay.
So people are like, oh, I take 5,000 IUs and I'm quoting a lot of stuff that Charles Poliquin told me. For those who don't know Charles Poliquin, he was like the best strength and conditioning coach in the world.
That's
like
Brian's dude.
Like, you want to win a gold medal, you go to this guy. This guy was so far ahead of his time. Damn. So when I did my blood test, I was like around like a 20 or something like that. And he's like, all right, so he put me on vitamin D. And he's like, all right, what do you, I'm like, all right, so what do I take? Like 5,000 IUs a day? He's like, what the, basically cursing me. He's like, what the fuck's wrong with you? Like, no, you're not taking 5,000. That's like doing nothing. That's absolutely nothing. And he's like, we're going to put you, he's like, how much you weigh? I'm like, about 200 pounds. He's like, we're going to put you on 100,000 IUs 2 times a week for 6 weeks. And I was like, 100,000 IUs? He's like, yeah. So he's like, trust me, you'll be fine. You're not going to overdose. You'll be fine. You'll be fine. And he's like, the reason is because he worked with a lot of athletes. You won't find this in any research out there, but he worked with so many athletes, and he had everyone constantly doing blood tests. So I trusted him, and I went from 20 something as my blood levels for vitamin D. Within 6 weeks, I was up to 90 something. And he's like, doing 2 mega dosages twice a week is far, far more beneficial than doing 5 or 10,000 IUs every single day. And
So
what's interesting, I'm actually learning a lot about supplements lately.
Okay.
And the big thing right now is people are seeing better results pulsing their supplements. And what I mean by that is, like, if you take a multivitamin, say people take multivitamins every day, people are getting better results taking a multivitamin one day, pause one day, taking a multivitamin the next day, pause one day. So giving that break in between, what they call pulsing. But the problem is supplement companies don't like this, because now people are using their supplement half the time.
Right.
So it messes with, their profits. But pulsing supplements is actually, from independent research, they're showing that it actually has better results than taking something every single day. So a little food for thought there with people.
Dude, so is it? So I'm curious, when you were taking that many IUs, was it like in a day you were just popping pills, man? Like,
yeah, actually, like just say there were 5,000 IUs. I was taking like 20 vitamin D. I was like, just chucking them in there. Yeah,
shit, bro.
Yeah,
and 2 times a week.
Twice a week. Yeah, I would do it every 3-4 days. Yeah, I was doing like Tuesdays and Fridays, or Tuesdays and Saturdays, and I was doing that. And then when I went back 6 weeks later, did my blood test, and I was like, yeah, I was around 90. Then you have to, I just kept it. I just kept doing that for about a few years, and I would never really go over like 90 to 100. And he's like, you're fine. He's like, you're fine. Like, it's not going to grow it. It's not going to get any more. And he's like, you're living in the Northeast. You're barely getting any sun in the wintertime. Like, you need this. That's why people get, like, he actually is the one who taught me. It's like, people get sick for 2 reasons in the wintertime: low vitamin D and low glutamine in the body. So he's like, you crank up your glutamine, which helps keep your immune system from suppressing. It's also 90% of your intestinal lining is made of glutamine, and cold weather mixed with cardio is a bad remedy for depleting your glutamine. So adding extra glutamine in your system, that's a whole nother topic we can talk about. But you really want to double or triple up your glutamine and just crank your vitamin D levels up through the summer, through the winter time. And ever since I did that, since like 2012, 2011, when I started working with him, I don't even get a sniffle in the winter time. I just crank it up everything.
Interesting.
As I'm coughing now.
I was about to say, as you call it.
I need more vitamin D. Yeah.
Mm-hmm. Dude, this is really interesting. I'm glad I asked that, because I'm thinking that, okay, we're gonna like taking a supplement. Yeah, but I like the idea of a couple days a week, like just going all in, taking the whole bottle, man.
Yeah, crank it out. Go.
Crank it out, man. Let's go.
That's it.
This is wow, man.
Yeah, but if you have your vitamin D, the whole point is, like, if you have your vitamin D levels at an optimal range, again, normal is trash. Go optimal range. I'd be hard pressed to say that your blood pressure would not go down. I can't see it not going down.
Yeah.
Again, I'm not a doctor. I'm not gonna guarantee anything like that, but try that first. Most people are sick because they have low vitamin D levels. Every single cell in your body has a vitamin D receptor. It's so important in your body. So try that. And it's one of the cheapest supplements you get. Get D3 vitamin D, not D2. D2 synthetic.
Dude, I gotta tell you, man, like, I like to experiment with my body. So I'm gonna do this experiment.
And you know how to do this, and I'm talking to you as do muscle testing on yourself.
Yeah. Yep.
Yeah. And you can figure out how many dosages you need.
Bro.
Yeah.
I'm about to go in, man. Listen, because my goal for next year, this is my intention. Next year I'm getting off of meds.
Mm-hmm.
And I just had a 6-month checkup a couple weeks ago. I told my doctor the same thing. I was like, listen, man, I'm getting off these meds. He was like, okay, let's see what happens. Let's go for it. He's like, let's go for it. I'm all for it, Paul. I'm all for it. He's like, I like seeing you, but I don't want to see you.
Yeah. And you're going to notice you're going to get stronger in the gym, and you're going to lean up, because it is a growth hormone. It's a natural growth hormone. When you get your vitamin D levels under check, like one of the people, I've had people come to me all the time. They're like, I'm working out, 5 days a week. I'm doing all this stuff. I'm eating right. I just can't drop body fat. Like, let me see your blood test. And they look back and their numbers are like 19, 16. I'm like, dude, you got no vitamin D in your body. He's like, oh, what's that? Like, and I got to explain it,
Mm,
It's like you're taking all you're taking all the steroid hormones out of your body, the natural steroid hormones out of your body, you know? So
bro, I'm in. I'm in with
that,
it, bro. Listen, it's a wrap. I'm gonna pick up some D3 after this call, man. I'm like, let's go.
yeah, man.
Actually, I think Lifetime's got them. Lifetime's got it.
Yeah, go there, man. Put that shit on auto ship and get you 50% off. Yeah.
Ding, ding, ding. So B, we got a couple more, man. You
Yeah,
got
bud.
so we started talking about this already, in this
Mhm.
blood sugar
Yeah,
and
man.
regulating blood sugar. So talk to us about that. Like, because you
Yeah,
mentioned, because I mentioned this about diabetes before, and you said that like if you're diabetic, you will end up with hypertension. Can you talk a little bit more about that?
yeah, man. So it's like when you have too much glucose in your bloodstream, your red blood cells, they start to get sticky and they stick together. And they also stick to the walls of your blood vessels. So it's basically just starts clogging everything up. And that just makes the heart have to pump blood more to kind of get through. So the narrower the vessels, the more pressure builds up, like you were talking about before. And another thing is too, as the red blood cells, they start bumping into the blood vessel, and it damages the arterial wall of the blood vessel. Does that kind of make sense? That was pretty much like,
Yeah.
I mean, not too
So
much behind
what I'm
it as
hearing
far as
is
that.
like, if there's too much blood, if there's too much glucose,
Uh-huh.
basically it's like it becomes a bumpy ride in the blood vessels. So like the blood so wait, the blood cells will bump up against the vessel and like make it like a rocky road, which creates more
Yeah.
constriction in the blood vessels. Is that right?
Yeah. Yeah. Kind of they kind of like stick together, and then they stick to the
Like they
blood.
clump.
Yeah. Yeah.
Damn. So it's like it's like glucose sugar. So it's a sticky.
Yeah.
Makes the blood cells sticky. So they're clumped together, and then also it makes it that so that in turn makes it much more difficult for blood to flow because now it's
Yep.
all clumped up.
Yeah. And there's a test you can see too, is called the hemoglobin A1C test.
I've heard of that before.
Yeah.
Yep.
So basically what that is, it's a 3 month life, like basically a 3 month check on how much sugar is attached to your red blood cells. So you want to keep that under control. So when somebody comes like, so when I see somebody, like I put them on a diet or whatever like that, and they're like, I'm not losing any weight. And I'm like, are you eating a lot of sugar? No, I promise I haven't eaten a lot of sugar. Then I see their H1 tests and their levels are really high. I'm like, dude, it's showing right here that you're eating a lot of sugar. That's why it's sticking to your red blood cells. And that's why you're not losing any weight. So that's an important test to kind of look at. It's called your HbA1c test, your hemoglobin
Yeah,
A1C.
I'm
Mm-hmm.
looking at it right now. Yeah, it's
Yeah,
wild
basically,
because
again, it shows your average of blood sugar that over the last 2 to 3 months.
dude, it's interesting, man. Because like I'm thinking, my brother told me about a gene that we have in us that we got to be careful of. And in this, he's talking about like our family line because he had to get a whole
Mm-hmm.
bunch of tests when he was like getting tested for like kidney transplants and
Yeah,
donors. I think it was the A1C gene, but I gotta look it up and see what it was. But when you said HbA1c, I'm like, was that what
yeah,
it
I have no
was?
idea. Yeah.
I'm gonna find that out because maybe there's a part two of this because there was something and because when they talk about, oh, this is hereditary, like, and
Mm,
that's and that and we talk about words, even saying something's hereditary or it's in your family history, it's like you're predetermining that this is going to have an impact on you, when in reality it's more something to be aware of, to address.
sure.
Okay. It's not like, oh my god, oh, you now had
Yeah.
heart disease, oh, you got it now, son. Like, no, man,
Yeah.
it's just like it's just something to more be aware of as far as what's happening in our body and certain conditions in the body to be aware of and address,
Yeah.
to correct or right or course
Yeah. And
correct.
you also got to realize it's like people, you can't blame your genes.
No.
I have 3 books back there with Bruce Lipton, who basically really
Oh,
pushed epigenetics out there, and he says genes, anywhere from as low as 3%, your genes actually play a role in your life. So you can't be blaming your genes. The problem is you have certain environmental factors that unlock these genes. So the goal is to not unlock those genes with environmental factors. So like maybe your magnesium is low, maybe your blood sugar levels are too high, maybe your vitamin D levels are low, maybe you don't have enough nitric oxide in it. And then all of a sudden you start getting cardiovascular disease and you're like, oh, it runs in the family, it's genetic, it's supposed to happen. No, man. Like
no.
take responsibility of yourself. It's not the way it works,
Dude, and this is important for people watching. Take responsibility. I think this is the third time we've said it now, because people I'm speaking for myself. I recognize when I've said like, oh well, everybody in my family's got heart disease. Yeah. It's like I'm basically succumbing to this. I'm surrendering, like, oh, there's nothing I can do.
Yeah.
Give me my meds, doc. Come on. No,
always,
man. No,
always empower yourself, man.
Always empower yourself, man. That's one of the reasons. Well, that's one of the main reasons we have this podcast, and we're going over this information, because there's things that you can do to address your levels, your genes, and all the stuff that they're telling you you're supposed to have just on your genetic disposition. It's a bunch of hoo-ha. All right. Let's talk about the magnesium level, because when I was going over what you had written down, I was like, dude, let's talk about this, man, because
this was interesting. Yeah, this was interesting. I watched a couple documentaries about doctors, and I watched 3 documentaries on doctors in the last couple months about magnesium and hypertension. I mean, that's how I party. I love it. I'm just a nerd, man. Let's see what magnesium does with hypertension.
Nice. I love it, man.
So it was interesting. A lot of these doctors, back in the day, they saw really, really good results with magnesium citrate. Okay. But the problem is that there was very little profit in selling magnesium citrate. So what happened to these companies out there, instead of raising the price of the citrate, because it ended up costing more, and then there was a big shortage of citrate, they went with something called magnesium oxide, which gets absorbed. They said 10% in your body. I've actually read independent research that say it actually gets absorbed up to about 3% in your body, and it doesn't work whatsoever. So if you're going to do magnesium, the reason I bring this up, because if you go to I used to work at the GNCs and vitamin shops, and a lot of their magnesium there is just absolute shit. It's the magnesium oxide. And again, your body breaks down about, we'll even say this to be, 10%. You're basically pissing out 90%. But the problem is it's so cheap. People go there and they get it. It's cheap. So
magnesium oxide is a cheap one.
Yeah, you want to get magnesium citrate. That's the best thing for lowering blood pressure. So, and again, it's magnesium. It's difficult to get. How do I say this? You don't want to, when you're taking the magnesium, the back of the bottle, the recommended dose is normally such a small unit or small dosage that you're not going to really feel it. Another thing I learned from Charles Poliquin back then, women should take about 1.2 grams of magnesium a day, and men should take about 2 grams of magnesium a day, especially if you're working out. When you work out, your body just depletes magnesium. Anytime your body's under any kind of stress, it leaks magnesium. So you want to, a lot of these doses maybe have 200 milligrams. So people will take 200 milligrams. That's basically 1/10 of the dosage that a male should be taking. So it's nothing. You really want to find a high dosage, something that you can take basically 2 grams of magnesium and space it out about 2 to 3 times throughout the day. That's what I learned from the late Charles Poliquin.
That's
I mean, everyone is basically magnesium deficient. We just have so much stresses in the world that it just leaks magnesium constantly. So
these things that it's so wild that so for example, is the magnesium, so coming back to something, the magnesium, things like the magnesium, vitamin D we talked about as a supplement, but the magnesium citrate, that's a supplement too, or is that something
Yeah.
that we get that we
Yeah.
can
Get
get
into
in
supplement
food?
form. I mean, you would have
Supplement.
to eat
Okay.
so much greens to get that much magnesium in there.
Oh,
And the
really?
reason, yeah, and the reason we bring magnesium up in this is because as far as hypertension goes, the magnesium acts as a natural calcium channel blocker. What does this mean? It means
Okay.
it prevents calcium from entering the cells of the heart and the arteries. And what the reason we want to prevent calcium from entering the heart and arteries is because calcium causes the heart and arteries to squeeze stronger. So by blocking the calcium, the blood vessels can actually relax. So again, it has like an inverse relationship. So the higher magnesium dosages, the less calcium getting in, less stress you're putting on the heart and the arteries. Less magnesium in there, higher the stress you're going to be putting on your heart and arteries because you have too much calcium in there. So the
Mm.
problem with magnesium is that it's very difficult to get it in our diet unless we're eating super, super, super healthy, which is about 1% of 1% of the population, you
Yeah.
know, you know. And
Wow.
plus our food is absolute shit these days. I mean, like, I keep going back, like our food is like, we've had this conversation before. If we take our food supply, there's over 30 something countries out there who would be like, no, this is poisonous. Our food is poison, basically. Unless you're eating strictly organic, we're slowly poisoning ourselves. But that's a whole other topic.
Damn,
So
man. Yeah,
take,
that might
take,
be a topic we go over for organic and but I mean I think we really touched on
yeah,
glyphosate.
yeah,
Like those videos we really went in. But dude, this is very interesting. Like there's a couple things. So for people watching, especially the people with heart disease,
hmm
I'd like you to type in the comments what you're taking away and what's an action step that you're gonna take.
yeah,
Because we talked about being proactive a couple times and really being responsible
yeah,
for your health and well-being. So if you got heart disease and you're on medications like me, type in the comments what's the action item you're gonna take. What's the action you're gonna take? And actually, when this comes out, I'm going to type it in myself. I'm going to tell you right now. Like
yeah,
my thing is to order D3, vitamin D3, and also magnesium citrate.
yeah,
Um, I think it's important, man, because I think if I could, I do that, then I want to see where it is, and again, like allow your body to be treat your body like an experiment. Like, see what
yeah,
happens.
yeah.
Happens.
And another thing, like when you're getting your blood test done, sometimes the doctors kind of mess this up. So you want it, your serum magnesium levels aren't a good accurate indicator of your magnesium levels. You need red blood cell magnesium levels checked. It's a big difference. So make sure the red blood cell magnesium levels, not serum.
Perfect. I'm getting my blood work done another
Yeah.
month actually.
Tell the
That's
doctor what's up.
Yeah, most deaf. Be like, yo, doc, make sure you get that in, son. Hook it up. Hook it up. I think it's we're gonna start to wrap up now, and originally I wanted to get into the metaphysical piece of heart disease, but I think you and I are gonna save that for another episode so we can
Okay.
focus on that. I think the one thing I do want to leave with is something I heard you say about the epigenetics and the cells and the genes, and I want to circle back to that before we wrap up. Listen, when you hear, when you know, if you like, you're gonna know what your family history, medical history is, and I think it's important. What you said, Brian, is that environmental factors can activate these genes and also deactivate. Correct?
Yeah.
So I think it's important. People, please be aware of the environment that you're in. And I want you to think about a couple ways, like the environment that you're in, as far as like the people. What are the stress levels that they bring to you? We're all going to go through stress. There's de-stress and there's a eustress. We're all going to go through stress, but what's the environment that you're in, and what kind of stress is it providing for you? The next thing I want you to be aware of is what's your environment as far as your food. Okay, because like Brian mentioned it already, like our food is doo doo brown. Okay,
hmm
so we want to be aware of like can we do organic, right? And even if it's like hey, Paul, I'm on a budget. Okay, got you. Listen, man, this is an investment I'm talking about right now.
Yeah.
Because if you're failing to eat properly, then like that's an adjustment you get to make, right? And what that looks like for you and your circumstances. And then also making sure that doing your best to have supplementation, because all of our food, like a majority of our food, is free of being nutrient rich. Okay. So these supplements that Brian was talking about, things like the vitamin D3, the magnesium citrate, even when we're talking about the nitric oxide and things like this. These are all, and actually the nitric oxide you can get from foods, right? So we mentioned that before, like your bok choy, your beets, your arugula, your butter lettuce. So these are all things like, people, you can take responsibility and you can shift your environment to improve and optimize your health. That's another word from this I want you all to take away with. F the freaking normal levels.
Yeah.
Optimize your stuff. All right. Optimize your shit. Anyway, I got my soapbox right there real quick, man. You know, it happens sometimes, B. It's coming from the heart, son. You know.
Love it.
So listen, B, Brian, anything that you wanted to express or talk to from what you research and what you look into before we wrap up, man?
Man, there's so much. I mean, we're gonna keep this short. Like Paul said, let's get into I would highly recommend getting supplements, because it's so hard to get your supplements through food nowadays. But like, it's just not enough. You would have to eat so much, and especially if you have high blood pressure, take control of it. And again, like I said before, the most important thing about a supplement is his last name. It's not his first name. So there's a lot of confusion out there. If you have any questions, drop a comment in the chat box, and I'll tell you exactly what to get. You know, I could send you links, or I could tell you, hey, listen, get it through here. This is probably the cheapest source, or the cheapest, the most least expensive, but the best thing for you. And then Paul and I will lead you in the right way. And like Paul was saying before, with like genetics, it's not a death sentence. There's always something you can do. And for, like Paul said, like, your food is going to be the most important. Sacrifice a little bit. I mean, like, to eat a little healthier, cut your expenses somewhere else to eat a little healthier. Because if you're trying to pinch pennies and you're saying, oh, the food's a little expensive, I promise you it's a lot more expensive when you come down with a disease. A lot more expensive. And put yourself in a good mental, emotional state. So I talked about this before, the way your body works on a holistic level, and muscles are controlled by organs. Your organs are controlled by hormones by your foods and thoughts. This is where everything starts. So you can eat all the good food you want, but if you have a shitty attitude about life, yeah, I got bad news for you. And that's where the whole metaphysical part that Paul was talking about, that's going to be another episode. So
going in, bro. Because I'll tell you what, man, that, like, bro, thank you for that, man. That metaphysical piece, especially when the metaphysical, as far as hypertension or heart disease, a lot of it is about anger.
Oh yeah.
A lot of it is about anger, man. And something I had to address is my anger to help my blood pressure lower, bro. Because there's some situations that I was experiencing, and over this course of this podcast, I think you all have heard some of them. But we're gonna go into, we have some other things that are coming up for our recordings and the episodes, and we're gonna address this because as Brian said, like, thoughts control a lot of things. So we're gonna dive in. All right.
Yeah, man, we have a lot of episodes, man. You're gonna be seeing these mugs for a while, people. We're not going anywhere for a while.
Yeah, and listen, man, you're gonna be seeing us for a while. Hopefully, maybe I can grow a beard. I don't know. I like growing patches right now. So who knows? All right, listen, everybody, thank you. If this was the first time that you're joining us, that you joined us, thank you so much for giving us a go. We want you to come back and also check out the previous episodes. Brian mentioned a couple of episodes that we've done before, so you're gonna see him around our faces somewhere. One is the nitric oxide,
glyphosate,
and the glyphosate videos. Watch these videos. Valuable information. It's an opportunity. If you like what you heard here, it's an opportunity for you to dive into a little bit deeper and learn some more information and insight that's going to help you take personal responsibility for your health and well-being. So, Paul,
subscribe, like, share, comment. You guys commented a lot in the last couple of weeks, and we're getting back to you. We're going to answer all your comments. So If you have any questions, let us know.
Please, yeah, I love the comments, man. I'm
Yeah.
like, yo, actually, you know what? We're gonna answer these, and like, we keep them coming, man. Keep them coming. And Brian mentioned something too, and then we'll wrap. Listen, if you have questions on what Brian's saying, Brian is a nutrition guru, man. Like, as far as supplements and like things to really, because he does the research. He does the research. So, like, listen, put something in the chat if you're unsure about something. Like, let's chop it up. Let's figure out what works for you. And like, yo, this is one of the reasons that we're here. So thank you all for joining us. And until next time, like, share, subscribe. We're out.
Peace.
Peace.